Hello everyone, welcome back to the channel Microbial World. In today's video, we are going to discuss about immunodeficiency disorders. Our immune system protects us from infections caused by bacteria, viruses, fungi and parasites. When this defense system does not work properly, the body becomes more prone to infections, either because the immune system is weak or missing components. This is called an immunodeficiency disorder. It results in frequent, severe or unusual infections. There are two main types of immunodeficiency disorders. Primary or congenital immunodeficiency, which is inherited or genetic defects, and secondary or acquired immunodeficiency due to external causes like infection or drugs. Primary or congenital immunodeficiency. These are genetic defects present from birth. They occur when one or more parts of the immune system like B cells, T cells or phagocytes do not develop or function properly. They are usually detected in infancy or early childhood, but some mild forms appear later in life. Severe combined immunodeficiency or SCID. In SCID, both B cells and T cells are defective. This means the body has almost no immune defense. Babies with SCID suffer from severe repeated infections like pneumonia, diarrhea, and skin infections, often within the first few months of life. It is sometimes called bubble baby disease because affected babies must be kept in sterile environments. Bone marrow transplant or gene therapy can cure SCID. X-linked agammaglobulinemia or Bruton's disease. This disorder affects B cell development. The B cells fail to mature, so antibodies such as IgG, IgA or IgM antibodies are not produced. So the patient cannot fight bacteria that depends on antibody response. The disease mainly affects boys because it is X-linked recessive. Symptoms include recurrent ear infections, sinusitis, and pneumonia starting around 6 months after maternal antibodies fade. The treatment method includes regular intravenous immunoglobulin therapy. Selective IgA deficiency. This is the most common primary immunodeficiency. The body fails to produce immunoglobulin A, that is IgA, which protects the mucous membranes of respiratory, digestive and genitourinary tract. The symptoms include recurrent respiratory infections like sinusitis and bronchitis, ear infections, diarrhea, and sometimes allergies and autoimmune diseases. There is no specific cure. The infections are treated as they occur. DiGeorge syndrome. It is caused by defect in chromosome 22. The thymus gland where T cells mature is underdeveloped or absent. This leads to T cell deficiency, resulting in poor defense against viral and fungal infections. Symptoms include recurrent viral and fungal infections, heart defects, low calcium levels, and facial abnormalities. Treatment method includes calcium and vitamin D supplements or thymus or bone marrow transplant in severe cases. Chronic granulomatous disease. This is a phagocyte disorder. The white blood cells called phagocytes can engulf microbes but cannot kill them due to defect in enzymes. The body forms granulomas, that is, clusters of immune cells around the infection. Symptoms include recurrent abscesses in skin, liver and lungs, infections with catalase-positive bacteria like Staphylococcus aureus and fungi. Treatment includes antibiotics, antifungals and sometimes bone marrow transplant. Secondary or acquired immunodeficiency. These are not inherited. They develop after birth due to external factors that weaken the immune system. Common causes include infections like HIV, malnutrition, cancer and chemotherapy, radiation exposure, steroid or immunosuppressive drugs after organ transplant, chronic diseases like diabetes, kidney failure, or liver disease. HIV or AIDS. Human immunodeficiency virus attacks and destroys CD4 plus T helper cells, which is vital for coordinating immune response. When CD4 count drops too low, the person develops AIDS, that is, acquired immunodeficiency syndrome. Symptoms include persistent fever, weight loss, night sweats, and opportunistic infections like candidiasis, tuberculosis, and pneumonia. Antiretroviral therapy helps to control the virus and restore immune function. Common symptoms of immunodeficiency are frequent or severe infections, infections that last longer than normal, unusual infections caused by rare organisms, slow growth or weight loss in children, chronic diarrhea, swollen lymph nodes or spleen. Diagnosis. Blood tests are the first step in diagnosis. They check the number and function of immune cells and antibody levels. It includes total white blood cell count. It measures how many immune cells like lymphocytes and neutrophils are present. Low WBC count indicates possible immune system weakness. Antibody levels such as IgG, IgA, and IgM. These are immunoglobulins made by B cells. Low levels indicate that the body is not making enough antibodies to fight infections. For example, low IgA levels points out to selective IgA deficiency. Flow cytometry is a special test that measures different types of immune cells in the blood. It identifies and counts T cells, B cells, and natural killer cells. For example, low T cell count indicates Digeorge syndrome and a low B cell count indicates Bruton's disease. Genetic testing is used for inherited, that is, primary immunodeficiencies. They look for mutations or deletions in the gene responsible for immune function. For example, deletion in chromosome 22 indicates Digeorge syndrome. HIV test is used for acquired immunodeficiencies. As we know, HIV infection is the most common form of secondary immunodeficiency. So the test detects HIV antibodies or viral RNA present in the blood. If it is positive, it confirms HIV or AIDS. Treatment includes antibiotics or antivirals to control infections, immunoglobulin replacement therapy for antibody deficiencies, bone marrow or stem cell transplant for severe cases like SCID or chronic granulomatous disease. Gene therapy is still under research. Antiretroviral therapy is used for HIV or AIDS. Another important thing is to follow a healthy lifestyle, that is a balanced diet, proper rest, and hygiene. So this is all about immunodeficiency disorders. I hope that the video was useful for everyone. Do subscribe the channel for more informative videos. Thank you for watching.